Thank you to all who has joined us today. We appreciate your time and joining us in this presentation. And for those of you who have not heard much about NCFH, we're the National Center for Farm Workers Health, and we're a private not-for-profit organization located outside of Austin in Buda, Texas. And our mission is to improve the health of farm workers' families. And we do so through different technical assistance and resource sharing, as well as workforce development and training, supporting different health educational resources and program development, as well as many other things that you may have already participated in. And for today, our learning objectives are going to be to increase knowledge on available patient education resources and tools for prevention, screening, and treatment of diabetes. We're also going to be gaining an understanding of what diabetes-related resources are most appropriate to use for improved overall patient quality of care. We're going to be also going over how you can integrate appropriate diabetes-specific resources and tools into your current delivery practices. So as we go through the information, think of the materials that you are currently using, and think of those that you probably have not done an audit on, or maybe you're doubting if they're the appropriate resources for your patient population. So we're going to be identifying those appropriate resources as we move through different content. And we're going to be addressing the key components that you're going to be looking at. So we want to hear a little bit from all of you. This presentation is intended to be a very interactive one. We do want to hear and have you participate as much as possible on the different things that we're going to be presenting. So here we have a first question for you. And what are some of the things you need to look for when choosing the best resources for your patient? What is it that you look for? And you can enter it into the chat. And Megan, I don't see the chat. If you can give me some things that people are entering.
Yes, we have resources need to be easy to understand for those who may not be as health literate. Relevant information to the patient. There needs to be simple explanations. Again, easy to understand, culturally appropriate. Someone else said low health literacy, multi-languages, simple and lots of pictures. We need to assess the readiness of the patient. Again, someone else said pictures may be very helpful. Some more pictures, low literacy level, English and Spanish or other languages. It must be presented in a non-judgmental way. It must be engaging and interesting, short and to the point. And then someone else said engaging communication.
Yes, definitely. You hit on so many good points. You hit on health literacy, language. You pointed out the importance of visuals, and we can see it in the cartoon that we have in the slide. So you see it from their side. Looking at it on our end may look like a 9, and on their end it may look like a 6. So what is it? Being really clear about the information that we're presenting and making sure that we're answering their questions, not ours. So all that we're going to cover. And thank you so much for your chat and input. And we're going to go into assessing patient materials. So Here's a couple of things that we need to take into consideration when assessing patient materials. First of all, who is our audience? That's the basic question that we need to answer when analyzing any patient material. Who is our audience? What's their level of technical expertise? Is it going to be something that we're going to be sharing with our peers? So is it for health center staff? Or is it something that we're going to be sharing with patients? We need to take into consideration cultural competency within that piece. And we need to take also into consideration what you mentioned, their health literacy. So health center staff may have a very different health literacy level than our patients. And I'm sure it does. So we may understand that, but they won't. We also need to look at material or product organization and layout. How is the material laid out? Is it clear? Do we have a clear takeaway message? And let's ask ourselves, what is our intention by giving a tool or by giving a material or a flyer or a video? What's our intention? Is that intention clear? Is the main message prioritized? And I think that most important to see here is if their questions are answered, right? A lot of times we give materials that probably not answering what they want to know. So take into consideration that. The legibility. So by legibility, we mean plain language. It needs to be in plain language. We're not going to give a 10-page manual to a patient on how to operate their monitoring machine and expect them to read it and understand it. So it has to be visually, also visually appealing and colorful, easy to understand, and that it has to be in their preferred language. So there was a mention about English, Spanish, and taking into consideration that maybe in none of those languages is the right one for that patient. So it might take a little bit more digging into, okay, what is your preferred language? Maybe it's Vietnamese. And here in Austin, we have a huge Vietnamese population. So finding those resources for them might be your next adventure into the world of health education materials. So we're gonna dive into a little bit more into each of the components, a couple of them, and we're gonna be talking about cultural competency. So with culture, we're referring to the attitudes and behaviors, which are the characteristics of a specific community. By acknowledging them, we're being attentive to that cultural aspect of our patients. And a set of similar behaviors, attitudes, and policies that come together in your health center or among your professional team will enable effective work in cross-cultural situations. We also need to take into consideration language, English as a second language. For example, for me, English is language. You might already know that by my accent, but it might affect on the way people understand. We're also going to be looking at the organization and layout of the material. We're looking at a flyer here, an infographic, and it's nothing to do related with diabetes, but I thought, well, we'll take a break, right, from our diabetes world. And we're gonna go into analyzing this small flyer. I thought it was really well drafted. It clearly states a message, right, about world records. So If I want to break a world record working from home, what would that be? And it gives me 10 options. Each of the options is well delineated, color differentiated, and it also gives you a visual, right? So I may want to test the blindfolded alphabet typing in the coming weeks, but it gives you the information that I was looking for. So look for look at your materials that you have right now, and is that message being clear and prioritized, and are the questions answered? We're also looking at health literacy. And this was also mentioned between your responses in your chat. With health literacy, we refer to the degree to which individuals can process, understand basic information and services necessary to make appropriate health decisions. We need to speak in plain language. That is very important to take into consideration, as we need them to not only read, but understand. And we're gonna go into plain language a little bit more, because I feel that between all of the different characteristics that we're gonna be analyzing in our materials audits, plain language is one of the key ones. So what is plain language? Plain language is writing that is clear, to the point, helps to improve communication, and takes less time to read and understand on the patient side. So you can grab that flyer of world records, look at it, and clearly understand the point really quick. You don't have to read it again to see what it means. Your audience will understand the first time they read or hear it. It enables your audience to find the information they need. But not only that, you may know where the information is, but if you don't understand it, it's like talking to the choir, right? It's like singing to the choir. What's the phrase? If your document doesn't do both, it's not plain language. So use what they need to meet their needs. Why is plain language important? And this gets your message out clearly. It's very basic concept. You need to get your message out as clear as possible so that you can reduce complications. Right? You can reduce complaints to resolve. You can improve compliance. We don't like the word compliance, but I would say we can improve understanding of self-management on their side, on the patient side. We could gain more support from them, right? We can use more efficiently our staff time. How many times have you spent explaining the same thing to one patient repeatedly? So look at it and say, maybe I can find something that can help me get my message out clearer. We're gonna be also looking at different techniques that you can use. So first of all, you identify and write for your audience, not for yourself. You use your active voice. So be transparent, make sure that it's transparent. So you know who and what is doing the action. For example, new standards were proposed. What standards? Who proposed it? So many questions come to that mind with that statement, right? So maybe use the American Diabetes Association proposed new standards. Okay, now I know who did it, who proposed the standards. Eliminate ambiguity. In a passive voice, you might say the plan must be done. In an active voice, you must do the plan. Creates accountability for that person you're talking to. It involves them, and it's clear that they're the ones who are supposed to follow up with the plan and not you. Emphasize important messages. So we have an example here, and so often this is used. The symptoms are improved when you take your medications correctly. Wouldn't it be much more effective to say, take your medications correctly? That you are trying to emphasize, and your symptoms will improve, right? A little wording changes everything. We have to maintain paragraphs and sentences short. So try to keep sentences to 20 words or less, and paragraphs to 3 lines or less. Here we have an example of a complex sentence, I like to call, and I'll read it to you. I will provide you with suggestions on your performance so you can overcome the challenges you encounter every day while working on a difficult goal so you can feel less stressed. Did you all get that? Did you have to read it twice on your own? Right? Let's see an improved version of it, of the same sentence, the same concept. I help you overcome the daily challenges of working on a difficult goal so you feel less stressed. Simple. So making sure that we're not given a huge ugly worded document to read. Limiting jargon, legalities, and acronyms. So we need to avoid obscure and archaic language. And as we were looking and doing the research for this presentation, we came across the California widow with Megan, which we didn't know what it was. And a California widow refers to a married woman who is away from her husband for an extended period of time. I wouldn't use a California widow term with anyone unless I want to be hit with the stick, like in the cartoon. But yeah, avoid weird words that are not used like commonly or colloquially. Use language your audience are familiar with. So here we have an example. The patient is being given positive pressure ventilatory support. I didn't know that was a respirator. So avoid using long, unfamiliar words. Define your acronyms, which in the world of healthcare, I think we're so used to dealing with acronyms. And the acronyms that we use, we all know and refer to. It's like CDC, ES, but other people may not know. So make sure that you're spelling any acronyms that you're using. And lastly, I want to share with all of you the different assessments that are available that can be used for this purpose. I especially like the Patient Education Material Assessment Tool, the PMAT. You're going to have the link in this presentation when it's sent out. And it's really cool. It has you can access the written and audio-visual patient education materials. It gives you a spreadsheet that you can use, and you can fill out. It populates automatically the totals, and make sure that it's the right material for your patient population. Then there's the CDC Clear Communication Index, which is another tool used for the clarity and ease of use of written materials. And the suitability assessment of materials is another one. They're all readily available. You can access them and utilize it for your audits. And I want to challenge you to see how often do you audit the materials. Maybe you're using them since the beginning that you started your work where you are. And let's look at what we're giving our patients. And here's another one that we want some participation from you on. And we're gonna pull the poll out, and you'll be getting the poll shortly. And it says, what type of resource do you seek the most for? What resource that you're usually looking for, and you have to navigate the web and all the different websites, and you're trying to look for it and hard to find. So there's a couple of options in the polling question. If you have another one that we haven't think of or included in the response, please put it in the chat. We'll love to hear that. And the responses are coming in. And do we want to close it? And Megan, do you want to share the results with us?
Sure. Yes. Thank you, Maria. So yeah, now that Maria highlighted kind of ways or different techniques or things that you all mentioned in the chat earlier of how to best choose the right resources for your patients, we're going to go into a little bit of the resources that are found within our Diabetes Hub. So we thought we'd start off with this poll. So the types of resources that you almost look for, we have 33% look for activities to stimulate learning for patients. 21% of you indicated that you look for Spanish handouts for patients. Yeah, we've heard that very often too, that it's difficult to find handouts that are translated into Spanish. And then 42% said all of the above, and one person said webinars and trainings. Yeah, I'm pretty sure we're zoomed out with the pandemic and everything. But yes, thank you all so much for your responses. And then I also see in the chat, Donna mentioned clear explanations of diabetes and the best diets to follow. Yeah, different diets, especially that are culturally relevant, right? So now we're gonna go into, I'm going to highlight a little bit of some of the resources that you find in the Diabetes Hub. And let me just go ahead and share that link. I'm dropping that link in the chat, just in case anyone would like to kind of follow along or open up the website as we kind of go through this. So this section right here, the Diabetes Resource Hub, this is basically the main page of our hub. And these different tabs you can click on to go directly, like if you're looking for information or resources for prevention and pre-diabetes, you can click on that tab. If you're looking for resources on diabetes complications, you can click on that tab, or you can simply scroll through. But to start off, we're going to start off with the first section, which is the prevention and pre-diabetes. Maria, if you want to go to the next slide, please. So prevention and pre-diabetes, in this section, one of the things that I want to highlight that you can find and that you might find very useful for your patients is the online quiz. This is the Am I at Risk for Pre-Diabetes and Type 2 Diabetes quiz. It's a really simple quiz, really quick to do. It's only 7 questions, and it assesses if a person is at risk for having prediabetes. So amongst the information that they'll ask within the 7 questions entails like age, they'll ask for family history, blood pressure, ethnicity, wellness, gender, and BMI. So that's a really good link that you can share with your patients. Another thing I want to highlight from this section is a diabetes prevention toolkit. This is a really cool toolkit, which includes lots of different free resources and templates that you can print out and you can share with your patients. They are meant to offer additional assistance to help prevent and or reduce the risk of prediabetes. So the toolkit includes lots of different information on how to engage patients, how to engage healthcare teams, and ways to incorporate screenings, testings, and referrals into your practice. So you can, it also has, not all the handouts are available in Spanish, but many of them are. So you have the option to download Spanish handouts as well. I know that was one of the things that some of you all mentioned that you looked for often. So that's the first section. And then moving on to the second section that you'll find on our website or the Diabetes Resource Hub is the diabetes and COVID-19 section. So this one we actually recently added to our hub within these last 2-3 years with the COVID-19 pandemic. So as we all know, individuals with diabetes are more likely to have serious complications due to COVID-19. But there are many, many factors that can help in the prevention of these complications and to kind of help better prepare, right? So within this section, you'll find infographics filled with information that you can share, that you can print out, you can download. There's flyers, there's diabetes and COVID FAQ sheets, information on taking sick days. And then one of the things that I really wanted to highlight is the Diabetes Disaster Preparedness Plan. This was created by the Diabetes Disaster Response Coalition. So as we all know, whenever a crisis strikes, right, like the pandemic, or maybe like a major storm, or maybe like the freeze that we had in Texas last year, people might lose their electricity, people might have to evacuate their homes. Things happen all of a sudden, right? And so this was created to prepare individuals living with diabetes to kind of ease the stress and ease the worry in the event that a crisis or a disaster happened. It'll kind of save them a lot of the worry and time. They can just kind of pick up their disaster kit that they've already had planned out and just go. So within this preparedness plan, there's actually a checklist that patients can kind of print out or you can give to them. And they can kind of check off, do I have all my medications? Did I pack, the right foods? Do I have the information that I need? All of that, they can check. One thing that I also liked that was included in the preparedness plan was just a reminder for individuals living with diabetes, which states on there, if you lose your power and you have unused insulin, do not throw it out. In an emergency, it is okay to use expired or non-refrigerated insulin. So that's kind of just like a good reminder and a good highlight that's part of the preparedness plan, just because again, whenever a disaster strikes, we don't really have time to think, right? So very good tool if you'd like to share with your patients as well. And then moving on from COVID, the next section is diabetes self-management. Lots of great information in this section also. One of the things that you'll see here that you'll find is the diabetes statistic report. So diabetes is a serious condition that affects over 37 million Americans. 96 million adults in the US have prediabetes, but more than 84% of them don't even know that they have it. So that's more than 130 million Americans affected by these two conditions. And this is why the CDC, or the Center for Disease Control and Prevention, released the National Diabetes Statistics Report. So they release this every year, and it has all the update information and data on prediabetes and diabetes. The one that you'll find on our website is the most updated one, which is the one for 2022. And it includes information on risk factors for health complications, deaths, cost, and so much more information. So whenever you have the time to take a look at that, that's available to you. Additionally, there's also information about the ADCES 7 self-care behaviors, the Association for Diabetes Care and Education Specialists self-care behaviors. And these include like healthy coping, healthy eating, being active, taking medication, monitoring your diabetes, reducing risks, and problem solving. So these 7 self-care behaviors are really meant to provide kind of the framework for diabetes care and education specialists so that they can kind of work with people living with diabetes or pre-diabetes and help them really make informed decisions for themselves. So these self-care behaviors are really all about driving positive outcomes, right? And they're really person-centered, and they allow for the individuals or people living with diabetes to really make goals for themselves and see them through and really take control of their overall health. So lots of good information about that there as well. Another thing to highlight, we do have a really nice, it's a really cool patient education digital story, and it teaches viewers what diabetes is and the key steps needed to control diabetes. It's a bilingual digital story. It's called Apoyando a mi mamá con su diabetes, supporting my mom with her diabetes. So this would be really nice, a really nice resource to share with your patients, especially those who are more kind of like audio learners or visual learners, just something different outside of an infographic or a handout. And then lastly, for this section, so with the COVID pandemic, there were so many things that shifted with the healthcare setting, right? And new ways for outreach and engagement really has been an important factor to address. So we worked hard to develop lots of different new tools aimed really to build capacity with the care team and to educate members of the community. So one of the tools that we recently created that you'll find on our website is the Guide for Patient Self-Management of Chronic Illness through Teleeducation. Right now, if you're looking through the website, you'll see that there's the English version of it. We are currently working to launch the Spanish version of it. So you'll see that on the website very soon as well. And so essentially, the WhatsApp Guide tool allows providers to leverage the WhatsApp application to address some of the challenges they face. So this guide highlights one way of providing teleeducation to patients using WhatsApp. It also includes a participant telehealth readiness tool. You'll find that at the end. And this provides health centers a method of assessing a participant's readiness for teleeducation and just really their overall willingness and ability to utilize WhatsApp. Like, do they have access to a smartphone? Do they have a computer? Do they live in a rural area? Can they go to a library? It'll kind of help the health center staff also to identify how much training or support needs to be given to the patients before actually implementing the usage of the WhatsApp tool. So again, more on that on the website, and the Spanish version coming soon as well. Right below that, you will find a distance learning section. And this is where the fun comes in. So in addition to the WhatsApp tool, we also created a couple of other fun games tools for you to use. One of them is the Jeopardy game. So the Jeopardy game includes a step-by-step guide to set up your own Jeopardy game with national DPP participants. We did this one specifically focused on the session, Keep Your Heart Healthy. But through the step-by-step guide, you'll see information of how to kind of create your own guide or how to game or how to kind of change the content. It doesn't necessarily have to be focused on Keep Your Heart Healthy, but that's the one that we created, which you're free to use. So through this game, you can also offer prizes to keep the participants engaged. So everyone likes to win a little something. It doesn't have to be anything big at the end of the Jeopardy game. And again, this can either be played virtually or in person. and it is available in Spanish and in English as well. And then, so that one is specifically focused on participants or patients. But then we also have the Empowerment Trail game. And this is based, again, on the ADCS-7 self-care behaviors. And this one is focused on facilitators and health coaches. So it's a fun and engaging way for facilitators and coaches to practice their overall facilitation techniques. So through this game, facilitators gain practice through the utilization of different scenarios to better understand each facilitation skill. And the overall goal really is to help strengthen their skills and understanding to improve their delivery of the National Diabetes Prevention Program and increase the overall success of DPP participants. So a really fun way for, and this one for facilitators and health coaches, hopefully, to practice their skills. And then another thing I'd like to highlight in this section, and we're going to show you a brief clip, is a shopping and cooking tool that's available, which is an interactive map that guides you through a shopping trip at the supermarket to select healthy options to cook, and it's called La Tiendita. So Maria, we can please play, we're going to just play a quick clip of this.
You can improve your lifestyle and prevent type 2 diabetes by shopping and cooking healthy foods. The good news is, eating healthy does not have to be expensive. These 5 tips can help you shop for healthy foods and save you money. 1. Plan ahead. Make a list ahead of time and plan what you want to eat for each day of the week. 2. Substitute where you can. Think of foods you can change or replace. 3. Stick to your plan. Only buy the items on your list. 4. Eat before you shop. You have less temptation and cravings when you are not hungry. 5. Cook at home. Home cooking is less expensive and can give you leftovers. These tips can also be found in the Shopping at the Corner Store or La Tiendita resource. Now let's think for a moment about your shopping trip. This interactive map can help you look at each food section as you plan ahead and schedule time to shop for healthy foods.
Thank you, Maria. So yeah, there's a little bit more to the video. We just kind of wanted to show you just a brief snippet, but you can go back and look at it. It's on our site. If you click like on other foods and beverages or like fresh fruit and vegetables, they kind of show you more information about like the kinds of meats or the kinds of seafood, the kinds of dairies to look for.
The food section is shown
At the tiendita, and it is available in English and in Spanish. Someone just asked if it's available in other languages. So English and Spanish is what we have right now. And then towards the end of it, it also gives you tips on how to shop at the store, right? At La Tiendita, such as like using coupons or like looking for like the where it doesn't have to be expensive to buy healthy foods, right? Looking for the cheaper items or looking at the brand names and getting like the cheaper brand, kind of small tips like that on how to reduce your spending also when shopping. So definitely take a look at that and share with your patients. And then the next couple of sections here include healthy eating is a diabetes self-management section. And within that, you'll find all kinds of infographics, flyers, handouts, again, on healthy eating, on exercising, and additional support. So managing prediabetes and diabetes can be very overwhelming, right? There are so many different factors to consider. We have to remember our diet, remember what we put in our mouths. We have to think about exercising in addition to whatever else is going on in our lives, right? Remember our medications, everything. So within the healthy eating section, some of the things to highlight here, one of the ones that I really like that you should may want to share with your patients are travel with a plan handout. So especially with the summer coming up, maybe people are going to go out on vacations. Maybe they're going to go to the beach or visit family now that the kids are out of school. So this is a helpful way to kind of remind them how they can best travel and how they can best monitor their diabetes and really take care of themselves and look after their health. That's a really good handout to have. Another good handout for the summer coming is the summer fun and food for people living with diabetes. So kind of still having fun with food, still enjoying your meals, but maybe what alternatives are there, right? What substitutions can you do? There's also a handout on my plate and options for healthy cooking, lots of good stuff. For exercise, there's handouts and flyers and infographics on different types of physical activities, from like yoga exercises to lots of different stuff, even exercises, small little exercises or stretches that you can do while at work. There's also handouts on how much physical activity is needed and infographics on tips on being physically active. A really, really good resource within this section is called the Move Your Way tools. And within this, they offer lots of different videos that you can watch or that you can share, lots of different fact sheets on tips that make it easier to just get a little bit more active and really take the small changes, which can all add up to bigger health benefits, right? So just how small steps can go a long way. There's tools and resources for adults, for parents, and even for individuals during and after pregnancy, different physical activities that they can do, as well as different tools for providers. And then within the additional support section, it is always difficult finding ways to help a loved one living with diabetes. So there's a handout on that. There's also information on mental health and diabetes, depression and diabetes, medication checklist, and a really good resource guide on insulin cost savings. And then almost near the end here for the website, one of the last sections is on diabetes complications. So as we all know, diabetes can increase your risk for many other serious health problems, right? Some of these include eye problems, feet, teeth, kidney, heart issues. But with the correct treatment and recommended lifestyle changes, many people with diabetes are able to prevent these complications, right? So you'll see all kinds of infographics, good information, flyers to share on this too, with really nice images as well, like you all had mentioned earlier. And then lastly, there's a section for archived webinars. So here you can find recordings for all the past webinars that we've had with guest speakers and presenters. Some of the ones that I want to highlight are some of the more recent ones that we had this year in 2022. One of them was improving diabetes health outcomes through the lens of cultural literacy. There was another one on the FoodRx partnership for health equity. We actually also had one in partnership with ADCS, Sasha Ullman. And this one, we highlighted that the WhatsApp tool guide that I had previously mentioned. So if you want to check this out, Sasha also provides a lot of really good information on the DSMES delivery through technology before we kind of highlight the WhatsApp tool. So really good one that's available. Another one that we recently had was improving preventative health and self-management care for migratory and seasonal agriculture worker population. And that was presented by our guest speaker, Lauren Plunkett. And she's actually a person who lives with type 1 diabetes. So it was presentation was given through her perspective. So check that out if you have a chance. And then there was also the American Diabetes Association providing diabetes support in your community, which ADA came in and helped us with that. And then just for some additional resources, if you are looking, I know that I saw in the chat, somebody asked if we have resources on preparing individuals with diabetes who are preparing for a colonoscopy, for example. I'm not honestly sure if we have a resource like that. I don't believe so. We have created one on our NCFH website, but you can look for additional resources through ADC, yes. There's also ADA, the American Diabetes Association. Also a lot of great resources through the Center for Disease Control and Prevention, CDC, learning about diabetes, and of course the National Institute of Health. So many different places where you can look for different resources, and those links are on our diabetes resource hub as well. And then just to kind of recap, other things that we have done today. So remember, when looking for appropriate resources, think about who your audience is. Think about your patient population, right? Really get to know your patient population. And then when assessing the material, when kind of trying to figure out what are the best, most appropriate resources to choose, think about organization, culture, competency, think about the literacy, look at if it's in plain language, right? So now we have a few minutes left, and we're going to do a short activity, and we really want to hear from you. So if you can please, we are going to be auditing one of the resources that's actually found on our Diabetes Resource Hub. And this is, I guess, just kind of like a first step as you work to build your own diabetes resource toolkit. That's really what we want you to do. Go back to your health center, really start building your toolkit, adding resources that you can just kind of pick out and share with your patients. So as you're doing that, as you're building your toolkit, some of the 3 things to really think about are: who is your patient population, right? What resources would be beneficial to your diabetes efforts? How would you best integrate these tools into your service delivery practice? So let's practice auditing one resource. We're going to look at the content. We're going to look at the writing. We're going to look at the design and the images and illustrations. So kind of using the chat box, as I ask a few questions, like this first section, we have 4 questions regarding content. If you can please type into the chat, like yes or no, what do you see in the resource tool? What do you not see? Can we check off that on the audit? Or maybe, is it a sad face and we still need a little bit of work to do? So kind of help us as we audit this by utilizing the chat box. And Maria's going to be checking off the little boxes to see where we are. So this tool is called Healthy Habits from Home. Want to lower your risk of type 2 diabetes and improve your health. And hopefully you all can see that I know it's a little small. So for the first question, is the purpose of the material clearly stated? What do y'all think? From looking at this tool, at this resource on the screen, and I'm sorry, I know that there's like a little black box that comes off. But in looking at the screen, what do y'all think? Is the purpose of the material clearly stated? We have yes, yes, a couple of yeses, yes, yes. Okay, so yes, so we can check that box off.
Coming.
And then 2, is information organized in a logical, easy to follow sequence? What do y'all think? There's lots of information on here, right? How is it organized? Is it easy to follow? Does it make sense? Yes, yes, yes. So yes, let's check that box off too. And then for the 3rd one, does the material encourage readers to take an active role in their healthcare? So I don't know if you've had a chance to read it to yourselves, but it does talk about start a healthy lifestyle, how to join a virtual community, how to get connected. So does it really help to encourage readers to really take control of their health? Yes, we got a couple of yeses. Yes, yes, yes. Yes, and thank you all so much for joining in. So that's a yes for the 3rd one. And then the 4th one, is the material culturally relevant to your patient population? What do y'all think? Is the material culturally relevant? Even though this one, I mean,
I would add that it does allow for people to add their participant testimonial. So it does give you that option to kind of personalize it and kind of tailor it to your own
health center, right? Your own patient population. That's a good point. Thank you, Maria. Yeah, as Maria pointed out, if you see there's a section for participant testimonial that you can definitely add to tailor it more towards your health center needs and your patient population. You can also add your own sample logo and program contact information. Yeah, and there's a lot of yeses for this one too. And someone also said it's mixed as patients vary. Yes, definitely true. So that would be a yes. And then if we move on to the next section, that was a content. Now we're going to take a look at the writing section. So if you focus in on the writing, is the material written in plain language? What do y'all think? So Tiana did mention it does not state languages, just English, and is virtual, so maybe harder for older patients. Yes, and we do have this available in Spanish as well. We just pulled up the English one for this sample purposes, but yes, you're right. And the Spanish one is available as well. And so yes, lots of yeses for the first question in this one. So we can check that off. Is the average sentence length about 10 words or less? As Maria mentioned, we don't want to have it too wordy. Don't want to make the sentences too complicated. So from what you're seeing, is the average length about 10 words in each sentence? So yes, somebody said no. Yes. I'm so sorry. That was my doorbell. A couple of people actually said no. Do you want to provide a little bit of more? What do you see for no?
I think sentences are kind of long.
Some of them are a little long. You'll receive
they
a few.
They probably fall under the 20 words, but above the 10 words. So that's where we have to be careful, right?
Right. So we want to put a no on that one. And then are medical and technical words and abbreviations defined? If you see any medical and technical words, are they clearly defined? What do y'all see? I see a yes.
And there's several tools that are available to make sure that the level of the language that you're using is proper for your patients. So you can set it. We usually set our materials to 5th grade or 3rd grade level language. So making sure that you're not using words that are too cumbersome or complicated or that stay below that range.
Right. So I see a bunch of yeses for that one. Someone did mention prediabetes is not defined. And you're right. Someone may not know prediabetes. So that's a good catch.
Good point.
Thank you. Is the material written mostly in active voice? So remember the section where Maria talked about passive voice versus active voice. What do y'all think about this resource? Is it written mostly in active voice? Yes. Active, yes. Yeah, perfect. And then we're going to move along to the next one just for time purposes. We're going to look at the design. Let's look at the design of this form. Is the font and style simple and easy to read? What do y'all think? When you look at the font and the style, do you think that the patients will easily be able to read it? Yes, it's not too busy. Oh, someone said it's too busy for some patients. Yes. Okay, so again, it kind of varies with your patient population, right? Does the font size increase from body text, subheadings to headings? So is there different kind of font sizes to distinguish between different groups? Got a yes, 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 yes. Okay. And then are important points emphasized with bold or a box? So there is that box that's added in there. Yes, yes, yes. Yeses for the last one. Someone said, when I think of my refugee population, this would be too much. Yeah. And that may be so. Again, so you want to tailor it to again, you know your patient population the best, right? So you want to choose resources that really, really are going to be most beneficial to your own patient population. So that's where kind of getting to know your patient population comes in and why it's so important. So yes, thank you for pointing that out. And then we have like 1 minute left. So real quick, another thing that thank you all so much for helping with that and for joining in. We really, really appreciate you kind of interacting with this little activity that we had. But one of the last things to look at when you're auditing material would be the images and illustrations. And that's what a lot of you said in the chat, right? It's important to look at, to have pictures, right? And it's important to have images that are culturally relevant to your population. Again, do the illustrations have simple, clear lines without distracting details or shading? Do illustrations have clear captions and labels? Do illustrations show people, activities, and objects that are realistic? Like, is your patient population going to relate to the images that you use, right? Again, positive and culturally acceptable to patients. So yes, thank you all. Thank you all so much. That it does conclude our presentation for today. I hope you all got something out of it, and I hope you all access some of the resources found within our Diabetes Resource Hub. I'm Megan Martinez again with NCFH, and Maria Bustamante, our program diabetes manager for NCFH. For those of you joining us live, please stay on, as well as we'll be sharing an evaluation link, and we would love to hear your feedback. And we'll also be sharing a little bit of additional information. And for those of you viewing the recording, thank you so much for listening. Again, this concludes our webinar today.